Pain is essential for our existence. If there was no pain to stop us from harming ourselves, then we'd probably have lost most of our bodies already, thanks to the curious brains of ours. However, this same useful sensation can turn into the biggest hurdle in the path of your life, a nightmare that just doesn't seem to go away. In this video, we're going to uncover the truth behind chronic pain. What are its causes, and how can you get rid of it? All of this and much more, so stay tuned. What is chronic pain? If pain persists longer than 3 months, then it is termed chronic pain. Chronic pain can make it difficult for you to perform daily activities and can take the enjoyment out of life. The food that once tasted great starts to feel rather stale, and hanging out with friends that was once enjoyable starts to feel like an unnecessary burden. The constant pain can also induce mental disorders like depression and anxiety, which can further aggravate the situation. So it is important to not take chronic pain lightly and get on with the treatment as soon as possible. To treat chronic pain, the first to do is to identify its root cause. There can be many possible causes that can lead to the development of chronic pain. Let's look at the 7 possible causes of chronic pain. Number 1. Nerve damage. If you're feeling a shooting, burning, or stabbing sensation with the slightest of touches, then it could be due to nerve damage. Nerves are responsible for sending and receiving signals between the brain and the body parts. The same goes for the pain signals. When a heavy object drops on your foot, the pain signals travel from the foot to the spinal cord, and from there to the brain. However, when these very nerves get damaged, then you're in for a world of pain. Severe pain that gets triggered with the slightest of touches, and sometimes even without any touch. This kind of pain is known as neuropathic pain, and you do not want to experience it. Almost 1 in 3 Americans experience chronic pain, and 1 out of 5 of them experience neuropathic pain. Hence, it is a fairly common cause of chronic pain. There are several ways in which the nerves could get damaged. It might be due to a surgery or trauma. Maybe a viral infection got to your nerves, or due to some neurological conditions like multiple sclerosis, or even diabetes can also lead to this kind of pain. Post-traumatic pain is also often associated with nerve damage, but there's a lot more to it than that. Number 2. Post-traumatic pain. Everyone knows how excruciatingly painful a sprained ankle is. But the good thing is that the ankle heals quickly, in a week or so in most cases, and takes the pain along with it. What if that ankle pain was to persist even after the apparent recovery from that injury? What's even the point of treatment then? Post-traumatic pain is also sometimes called complex regional pain syndrome, or CRPS. Causalgia, or reflex sympathetic dystrophy syndrome, or RSD. So many names for one condition. The reason is that the cause behind the pain is not always clear. However, most of the time this condition is associated with faulty communication between the central and peripheral nerve systems owing to nerve damage. The name for this is causalgia. In causalgia, the feeling of pain is usually accompanied by inflammation and numbness. The intensity of pain during the original traumatic event, the treatment and care received after the trauma, duration of treatment, a history of alcoholism, and being of 65 years or older. All of these factors can contribute to the development of post-traumatic pain. Number 3. Cancer. Chronic pain could also be a signal of cancer. If you're feeling a dull, achy, sharp, or burning pain, but can't seem to put a finger on any particular cause, then there are high chances that it might be due to cancer. According to the Mayo Clinic, cancer can lead to chronic pain in several ways. First off, the presence of cancer itself can cause pain. Secondly, it may be because of growing cancer pressing against the nerves, bones, and tissue. And finally, the tumor can also release certain chemicals that too can trigger pain. To get rid of the pain due to cancer, you'd go for its treatment, right? But even chemotherapy and radiation therapy for cancer treatment can cause pain. While the treatment of the root cause may add to the pain, there are still several ways to make it more bearable while the treatment continues. Your first option is to go for over-the-counter pain relievers like aspirin and acetaminophen. If the pain is more severe, then you could also opt for opium-derived medicines. However, you'll have to provide a prescription to get your hands on one of those. Another option for unbearable pain is to use a nerve-blocking procedure, where a numbing medicine is injected into or around a nerve to stop the pain signals from traveling to the brain. Number 4. Post-surgical pain. Experiencing pain after surgical treatment is normal. What isn't normal is the pain that persists longer than 3 to 6 months after surgery. Surgery is one of the most frequently reported causes of chronic pain. A survey of 5,000 people suffering from chronic pain found that 22.5% of the people had developed chronic pain after surgical treatment. It has been estimated that around 10 to 50% of the people who undergo surgery go on to develop chronic pain after the procedure. Why is that? There are a lot of factors that can lead to chronic pain after the surgery. Preoperative pain lasting more than 1 month, repeat surgery, being a female, intraoperative nerve injury, and psychological factors like pre- and post-operative anxiety all can contribute to the development of post-surgical pain. Number 5. Psychogenic pain. It is a well-known fact that your mental condition can prolong or shorten the symptoms of a disease. However, you might be surprised to know that the beliefs can also trigger symptoms of a disease that isn't there. Pain attributed to psychological factors is commonly termed psychogenic pain. This kind of pain is living proof of how beliefs, fears, and strong emotions can manifest in the form of physical phenomena. Headache, stomach pain, and back pain are the most common types of psychogenic pain. It may occur due to mental disorders like depression, but most commonly it is associated with an emotional event like social rejection, grief, and a broken heart. People who suffer from this kind of pain are often subjected to criticism by the doctor and family alike since there's no apparent reason for the pain. However, it should be realized that pain that stems from psychological sources is as real as any other pain. There is often no physical cause of this pain, so it is a lot harder to treat. Just like belief and mental condition can induce this kind of pain, an improvement in the emotional state and beliefs of the patient are often enough to get rid of the pain. Number 6. Fibromyalgia. Sharp pain throughout the whole body is painful to even imagine, let alone to experience. If you are one of the unfortunate souls who is experiencing this, then it is due to a condition called fibromyalgia. Along with pain, patients also commonly report sleep problems, depression, headaches, memory problems, fatigue, and mental distress. It is not a common condition and affects only 2% of the adult population in the U.S. Some of the risk factors of fibromyalgia include older age, lupus or rheumatoid arthritis, post-traumatic stress disorder, being a woman, since women are twice as likely to be afflicted with this, repetitive injuries, and viral infections, to name a few. While the causes of this uncomfortable condition are still not known, there are ways to manage and treat it. Usually, the doctors recommend taking pain relievers, doing aerobic and strengthening exercises, using stress management techniques like yoga and meditation, and developing good sleep habits. Number 7. Inflammatory bowel disease. If the chronic pain is concentrated right around the abdomen, then it might be due to inflammatory bowel disease. There are 2 main types of IBD. The first one is ulcerative colitis, which involves inflammation along the superficial lining of the large intestine, and Crohn's disease, which is inflammation in any part of the GI tract. Common symptoms associated with this painful condition include diarrhea, abdominal pain, weight loss, bloody stools, and fatigue. This disease is the result of a faulty immune system that reacts wrongly to environmental triggers and causes the inflammation of the digestive tract. How to treat chronic pain. We have looked at the possible causes of chronic pain, as you must have seen that there can be many reasons that could induce chronic pain. Although treating the root cause of the pain is the best strategy, along with it, some common strategies can also help to manage and treat chronic pain. If you think that you'll just take a pill or two and the chronic pain would just vanish, then you can't be more wrong. Along with medication, you also need to include self-management, physical activity, and psychological approaches into the equation for an effective treatment strategy for chronic pain. Usually, common painkillers like paracetamol can give temporary relief from pain, and so they should be used along with other disease-specific medications. Other than medication, regular exercise, a healthy diet, and proper sleep regimen can help manage chronic pain. Finally, to summarize, the pain lasting more than months is termed chronic pain. The constant pain interferes with daily life activities. There can be many possible causes of chronic pain. The most commonly found causes are nerve damage, post-traumatic pain, cancer, post-surgical pain, psychogenic, that is pain induced due to psychological factors, fibromyalgia, or inflammatory bowel disease, among many others. To get rid of chronic pain, first you need to get treatment for the root cause of pain. You can also supplement the treatment with painkillers to deal with pain. Finally, lifestyle changes like eating healthy, getting exercise, and getting good quality sleep can all help you manage and treat chronic pain. With that, we come to the end of today's video. We hope that you benefited from this video. If you did, please hit the like button and share this video with your friends and family. Want to see more videos like this one? Please subscribe to our channel, Welcome to Wellness, and press that bell icon as well, so you never miss another video. We'll see you in another healthy video. Until then, take care.